Welcome back to Healthy Living. We had a fantastic conversation with Dr. Rachel Gibson. She's a pulmonologist for St. Tammany Health System, and she gave us a lot of insight into lung cancer screening and early detection. And now I have another fabulous guest with me, Megan Broussard. She works for St. Tammany Health System. She is our lung cancer screening coordinator. And as I mentioned earlier, November is United in Lung Health, the Power of Pearl Lung Cancer Awareness Month. So Megan, thank you for joining us. Thanks for coming back to the show.
Thank you for having me.
Yeah. So tell people what you do for St. Tammany Health System. What is a lung cancer screening coordinator?
So when a provider identifies someone who may qualify for lung cancer screening, they send them to me. I talk to the patient, explain what the program is. It's preventative care, just like, you know, you have your colonoscopy or your mammogram or anything like that. It's just a screening for lung cancer for people who are at higher risk. I help them get established with an appointment, answer any questions they may have, and then if there are any follow-ups needed, then I can help them get those follow-up appointments taken care of. And then when it's time for their next one the following year, I reach out and say, hey, it's time to come back in and get another screening.
So you mentioned that if you qualify, so we want to encourage people to talk to your primary care. We talked with this with Dr. Gibson about this. Be honest about your history, about your family history, so that you can be assessed as to whether or not you do qualify for that. So we've talked about this also before, that lung cancer screening, low-dose CT for lung cancer screening, is a relatively new screening.
Correct.
In the medical world. So you would say, what, 10 or 12 years now?
Yeah, 12, 15 years old, but I mean, nothing like mammograms and colonoscopies.
Right.
Like, we're still out there at our community outreach events and our health fairs, and people are saying, I didn't even know there was a screening for lung cancer.
And so you do have to meet certain criteria, and those criteria, as we evolve with this screening, are changing.
They are.
So what would you like to say about the screening criteria?
So the general screening criteria is ages 50 to 80, someone who currently smokes or has quit smoking within the last 15 years. But as Dr. Gibson mentioned, there are many other factors, environmental factors, family history, personal history of cancer, personal history of other lung diseases that do make you more susceptible to getting lung cancer. And so we like to take all of that into account when we're doing the screenings. And as you mentioned, the guidelines are constantly changing. Just a few years ago, they broadened the age gap for screenings. Now the American College of Radiology is saying, you know, even if it's greater than 15 years, like, you should be getting screened as long as you had a significant smoking history. So of course, you know, we're always waiting on the United States Preventative Task Force to catch up with those recommendations, and then in turn our insurance companies. But for right now, those parameters that I previously mentioned are the ones that are covered by your insurance and you can get screened for.
Good. Okay. I wanted you to kind of touch on that. And so, as always, with any test you're going to have, please check with your insurance company first and your primary care doctor to help you get those orders for those screenings. So November, as I mentioned, is St. Tammany United in Lung Health, the Power of Pearl. And, you know, as we know, Cancer Awareness Months, Health Awareness Months always kind of have a little color associated with them. And so the lung cancer color is white, and we like to do pearl because, you know, Louisiana oysters and pearls are pretty. So, but we talk about, you know, our tagline is no grit, no pearl. And that's kind of a tribute to people who are in the lung cancer journey or who are caregivers for lung cancer patients, just to show that, you know, you really have to have that grit, number one, to be brave enough to find out, you know, what's going on inside of your body, and then pursue that journey. So tell me more about why we do this. Why do we do this month?
This month is so important because I feel like lung cancer and people with lung health issues feel like that they can't share that. You know, we have these wonderful groups like the Pink Ladies and, you know, Bionic Babes and all these survivorship groups that get together and provide like a real sisterhood and a community for people that are going through the same things they are. But when we have some of our other cancers, there's not necessarily that support group. And so the wonderful thing about the North Shore and our community is that we are we have a giving spirit. Like we want to be there for people. people. And this walk that we're going to talk about in a moment has really evolved to not just like lung cancer support, but just generally lung health. I think there's two parts in every person's who's gone through this journey's life. There's the before you hear those words, you know, you have cancer, and then after you have cancer. And that completely changes everything for you, for your caregivers, for your family.
Right.
You know, it's just it's a different way of living now. It's just good or bad.
Right.
And you need to be able to go through that with people that you can speak to and have been there and have those experiences. And what's really exciting about where we're moving with our campaign this year is that we have these other groups that have other cancers or survivors with different things, and they want to help lung cancer survivors or people, you know, who have just been diagnosed or going through that journey. They want to help connect them to other people like them so that they will have that same support that other groups tend to get. So that's our big focus this year. It's just community and just coming out there and realizing that you're not alone. Like, I mean, I can't imagine what you're going through, but I'm here to tell you that I want to support you. I'm here for you. I'll be an ear for you. And that's what this whole community has really shown up for the last 3 years. And so we're so excited about the walk this year because it just continues to grow like that.
It's our third annual. It's November 22nd, and it's at the Covington Trailhead, and it's free. Okay, so it's free. We want to emphasize that. And I do want to say that at the walk, you will be able to lay eyes on our new Breathe Well Connection.
Yes.
Which is our mobile CT unit. So what kind of impact is that going to make in our community? So tell people, first of all, what it is. What is that?
So by the generous donation of Rich Mahdi and the Mahdi Cancer Fund, we have been able to, St. Tammany Health System has been able to purchase a mobile CT unit for screenings. This launched, I guess, May, June of this year, and we've really started going out to our more rural communities. We go to Folsom, North Covington, Bush, even Madisonville and Mandeville for people who don't want to go to our main facility in Covington to get screened. And it is just giving people the opportunity to get that same health care closer to home, where they don't have to worry about transportation issues. They don't have to worry about the inconvenience. A lot of this population is older. They don't like to get on the interstate. So to know that they can go to their doctor's office, have the test done right there. It takes about 5 minutes, and then get the same machine, the same text, the same radiologist, and be referred to the same amazing pulmonologist, without having, to make any real effort to have it done, has just been life-changing for this community. I've gotten so much positive feedback. We've scanned so many people. The schedule's always full, and we're looking forward to getting it to more places in the community and giving those opportunities to more people. And
we want to stress, it's like we're screening so many more people. What does that mean? What does that translate to? Well, the earlier you find anything that is going on in your body, the more likely you are able to resolve that issue with less invasive measures. And your outcome is going to be better generally. We can't say it for sure, but we like to say that the majority of the time when you find something earlier and get that treatment earlier, the outcome is going to be so much better.
Absolutely. And like Dr. Gibson mentioned, like, screening truly saves lives. It's, your outcomes are so much better. And it's not even just about surviving. It's about the survivorship. It's your quality of life. Like, everything is better when you find that cancer at the earliest stages. But even if it is a later stage, we still find it, and with the advancements in research and treatment options, just all around, whole outlook on lung cancer is just changing, and it's becoming, it's not a death sentence anymore. It's becoming, something that we can treat and we can take care of, and that's why we want to connect these community members to help encourage each other to get through this difficult diagnosis.
And I want to just say that when we were about to announce that we were getting the Breathe Well Connection, I asked Megan to help me get some insight into some background on what that would mean. And I just want to tell people, you were like, let me think how you put it. You were talking about how if you could help one more grandparent see their grandchildren. I mean, very sweet. It just touches my heart. Very sweet.
Yeah, I mean, like I mentioned with the demographic of this population, I love talking to these patients. They're grandparents, they're school bus drivers. You know, they're in that season of their life where they want to be healthy, to see more of that life. Like, they want to enjoy their grandchildren. They want to get healthier and have more Thanksgiving and Christmases, especially this time of year when I call them. They tell me what they're cooking for Thanksgiving, and the whole family's coming over. Yes, we have we exchange recipes. Like, we have big conversations, and because these are people that, you know, regardless of what their smoking history is, they want to live, and they want to have a healthy life, and they want to continue to be a part of their family and have a future with them.
Yeah, so I just admire the work that you do, so thank you for doing that. Is there anything else you want to add before we wrap up about anything around screening, education, prevention, how people can get in touch with you? So
I guess just going back to the walk, you know, we've talked about its evolution. We're including a children's fun run this year. We're really focusing on preventative health, as well as, you know, nutrition and vaping prevention, which is becoming such a problem with our schools, and just, you know, really teaching kids that if they take care of their lungs now, that they can, you know, be those active athletes and live those healthy, long lives. And so that's a really great part of the walk that we're including this year. And then, of course, you know, if you have any questions, if you want to sponsor the walk, if you want to sign up to be a part of it, if you want to get a lung screen, any of those things, you can always call me. My number is 985-871-5864 or 871-LUNG, L-U-N-G. And again, my name's Megan Broussard, and I'm happy to talk to you about all things lung screening and lung health.
Fantastic. Well, we are looking forward to our 3rd annual walk.
Yes.
Come out if you can. It is a really fun time, and it's growing every year.
It is. And it's November 22nd. It's on a Saturday from 10 to 1. It's at the free event. You can register now. It's at the Covington Trailhead. We have a band. We have food trucks. We have a food truck that's going to be raising money for Hogs for a Cause.
We have an inflatable lung this year.
Inflatable lung. You know, we have the fire department comes out. We have the Pink Ladies. Like I said before, it's about community. It's about, it doesn't matter what cancer journey you're on, or what cancer journey you've been on, or, you know, caregiving, or any of those things. Like, it's just about coming out and showing your support.
Yeah. So we also, I just want to mention, we want to thank our sponsor this year, Chevron, and we also want to thank the City of Covington for hosting us there at the Trailhead. And the band is Tyler Kinchin and the Right Pieces. So we're looking forward to it. Thank you, Megan. Thanks for being here.
Absolutely.
And thank all of you for watching. Stay tuned, because we're coming back with our guest, Rich Maudie, after this.